You hurt your biceps and now what? In this video, I'm going to go over my biceps injury, everything that happened. I tore my biceps, had surgery, and I'll let you know about what to expect about the surgery, other options, and post-operative care. So starting from what actually happened to me, I was at the gym working out normally. It wasn't the first exercise of the day, it was the third or fourth exercise that I was doing, but it was already warm. I did a few warm-up sets, and then I was doing lateral raises. I just heard a sound like a pop, and I felt like my biceps falling. So this was very scary at the moment. I just threw away the weights. My biceps felt weird at that moment. When I looked at my left biceps, it really looked weird. So as you can see on the video, there's kind of like a hole in the biceps, and this is because I tore the tendon of the long head of the biceps. So if you have any injury that it's not as serious as this, maybe you're just going to have some pain, but if you see some deformation in the bicep, swelling, a hematoma, if it's very red or purple, please go to the doctor as soon as possible, as time counts. So once this happened, I knew that there was something bad already. I wanted to go to the doctor as soon as possible, so I set up a first doctor's appointment with an orthopedist. He checked me, not doing any exams or anything. He already knew that there was something bad and probably I would need surgery. And he just asked me to do ultrasound of the biceps. So next day I was able to book already the ultrasound, but the doctor already told me that he's not specialized in surgery, so he gave me the contact of another very good doctor here in Warsaw, Poland, where I would be able to do the surgery. So I did the ultrasound. In the ultrasound, they confirmed that I had a torn biceps. And it was a complete tear. It was a tenodesis of the long head of the biceps, so not the one that you would use for a biceps curl, but mostly is the tendon that supports movements more related to the shoulder joint. After the ultrasound confirmed that, I went to this new doctor. At this new doctor, he asked me what happened. I explained what happened, and he checked me. He looked at my biceps. He said, yeah, there's a deformation there. It's something that we can call like a Popeye biceps, as it looks weird, like the biceps muscle gets short, so it looks like you're flexing the biceps all the time, or it just gets very short because there's no tendon pulling it. So the doctor told me that there's two options. Either we just let it be, let the pain go, the biceps recover, and this is what he would recommend for someone that is older, that a surgery would be more complicated, would be risky, or someone that doesn't exercise, or someone that doesn't use the biceps, because once you recover, you won't have any pain. The only thing you're going to have is like a deformed biceps. You're going to lose at least like 20% of the power of that biceps. So for older people that are in some risk conditions, they would not recommend the surgery. But as I work out, I'm younger, the doctor said that, yeah, he would recommend for me to do the surgery, and that's what I decided to do. But the doctor was still unsure of where exactly was the tear, because it depends on exactly which part of the tendon it was torn. There's different procedures. So I had to do another ultrasound the same day so that the doctor would actually confirm exactly where it is and how to proceed with the surgery. After the ultrasound, I went back to the doctor. Doctor confirmed, said, yeah, he knows what needs to be done, and I would be able to do the surgery in the same hospital as he's working, and he would be able to book me already probably for Friday. So I had torn my biceps on a Monday. I had this doctor appointment on Wednesday, and he said that he would be able to book me already for Friday surgery. And I'm saying this about timing because timing is very important for this type of injury. So if you wait too long, there are some doctors that will not do the surgery anymore because there's a lot of scar tissue that is being built. After a while, really, there's no other option. So if you get injured, go to the doctor as soon as possible, as you have options if you do it fast. And even like if you wait 3 weeks, some doctors won't do it. So go fast. And I was lucky that I was able to, within less than a week, I had surgery already. Now, all about the surgery, what the doctor told me is that the surgery is not extremely complicated, but requires general anesthesia. What they would do, they tie the biceps with a string, and then they drill a hole in the bone and they put the string inside the bone and pull the biceps like that. And in this hole, they put a bolt so that you can hold the string. So that's basically how the surgery happens. Like, the number of cuts is not very big, but in my situation, what happened is that I still had some tendon left in the top of my shoulder. So basically the doctor had to do 2 surgeries in one to restore the tendon, and another one to cut the rest of the tendons that were still left on the top of my shoulder. But the procedure would be basically 1 hour, and then full recovery to go back to exercising, 4 months. 4 months, non-negotiable, and even could be longer depending on how recovery goes. But 4 months to go back to the gym, to go back to normal activity. And the basic recovery is that for 3 weeks, you need to wear a sling so that you're not moving your arm much. You start physiotherapy after the first week, and then you just do rehabilitation all this time, so that you can get back the range of motion and go back to exercising. And one thing to note here is that I thought everything would be very easy, very simple, that, next days I would be fine and easy. But the doctor already told me that, I would only go back to work after 6 weeks, which I thought initially was weird. But yeah, that's what actually happened. And I can tell you that it's good not to be forced to work during that time, as it hurts. Now, going a bit deeper into surgery, I got the appointment for the surgery for Friday morning, and by my surprise, they wanted me to go to the hospital already on Thursday evening. So imagine that I had the doctor appointment on Wednesday afternoon, and they confirmed it. Then on Wednesday, it was Wednesday afternoon already, I was booking the surgery. On Thursday morning, I was doing the blood tests necessary for the surgery. So they check a few things like sexually transmitted diseases, some infections and issues that you may have, some things that may prevent them from doing the surgery. So I did this blood test in the morning, and then at the morning already, they told me that they wanted me to be in the hospital already at night in the same day. So it was a Thursday night. It was a huge surprise for me. But yeah, I arranged it. I went to the hospital on Thursday night. There at the hospital, they told me that it would be good for me to take a shower and use the antibacterial soap that they have there. And with this soap, like, I would clean myself and not bring any bacteria to the bed in the hospital. That night, I would have an appointment with general clinician just to talk about my situation, and for him just to see if there's any issue with the surgery or anything like that. And also, I would have an appointment with the anesthesiologist, just for him to check if there's anything preventing me to getting general anesthesia. Also, I had an appointment with a nurse. She asked me general questions about my health and things like that. They told me that I could only eat until 10 p.m. So I had dinner, I had some snacks, and I couldn't take any water or food after 10 p.m. As the surgery would be in the morning, I couldn't have any food in my stomach because of the anesthesia. So yeah, that night I had an appointment with the doctors, and then in the morning I woke up, no breakfast. I had to take a shower, clean all my body, especially my arm. You don't want to bring any bacteria to the operating room. So I had to take the shower, wear antibacterial soap, and put the hospital gown already. After the shower, the nurse came to mark with a marker which is the arm that needs to do the surgery and which is the shoulder. So she marked those, and then I was waiting, and she gave me a pill. I thought that it was already some type of anesthesia, but it wasn't. Probably it was just something for anxiety, so that if the person is a nervous person, you're scared of the surgery or something like that, you'll be calm. Like in my case, I didn't care. I trust the doctor, so it was fine. But yeah, the nurse said, yeah, like if you want to go to the bathroom, go before taking the pill because you may feel dizzy. I took this pill with there was just a little bit of water. So after a while, I didn't feel any effect of the pill. The nurse came and she said that it's time. So she took me to the operating room. I met a new nurse. The nurse told me just to relax, and she's going to put an IV line on my hand, so they can give me some the anesthesia and some medicines for the surgery. They moved me to another bed and straight to the operating room. In the operating room, there were already doctors prepared, and the anesthesiologist who just told me, okay, so it's time. After about 3 seconds, I started feeling a bit dizzy, and poof, I don't remember anything anymore. So very fast. I woke up in my room. At the point, I had no pains. I didn't feel much. I just noticed that I had a sling on my arm, and at the point, I noticed that the surgery was done. After a while, there were nurses coming to check on me, seeing everything was okay. This was already, let's say, on Friday afternoon. Then the doctor also came to check on me. The orthopedist came to say that the surgery was a success and everything was fine. And he wanted just to check how I was. He said that he would like me to stay in the hospital for one more day. So to leave on Saturday, just so that like I can relax and check the recovery, as the worst night is the first night. So they wanted me to stay there for that, and it was a good idea because when like they brought me food for the dinner, didn't feel very good. I felt a bit dizzy because of the anesthesia, a bit of nausea. So this part really wasn't good. Like I had to eat the food very slowly, sipping a little of water here and there. So this didn't feel good. Then at night, the nurse told me that, if I feel pain, for me to let them know. So I thought I would be okay, but when it was like in the middle of the night, I don't know if it was like 11 midnight, yeah, I had to call the nurse because it was very painful. And they brought more morphine, and also like I think it was like 1,000 milligrams of paracetamol to take on the veins. And I had this morphine drip all night long. Still, I had some pain, even with the morphine, but it was less than it was before. Like I was able to sleep a little, but yeah, that was it. I woke up the next morning. There was breakfast. Again, I felt nausea, mostly because of the anesthesia, but also because of the strong painkillers may cause nausea. So I had that also. And next day, doctor also came to check up on me. So they told me about what would be the procedure after the surgery. Let's go through what you can expect after the operation. First thing is that you're not able to take a shower or take a bath. You need to protect the place that was cut, at least for a few days until they take the sutures off. Maybe for a week, you need to wrap your arm with some foil, not make that part wet. So no shower or bath. You need to figure out somehow how you can clean yourself. I heard some people using wet wipes, but like in my shower, I have a small shower head, and I could just use it to clean the part of my body without making my arm wet. After the surgery, and not using the arm for anything, using the sling for 3 weeks. You can only take off the sling to put some clothes on and to take a shower, and that's it. All the time with the sling. Maybe some doctors have other protocols, but this is the protocol that I followed. I started physiotherapy like basically a few, yeah, it was about a week after the surgery. And the physical therapy was mostly to reduce the swelling and to start a little bit of exercises to move the arm, preserving the range of motion. This is what you can expect. I had some exercises to do at home, also related to that, and no swimming pool, no saunas, no sport activities, so nothing like that, at least for 6 weeks. And then no gym, even no not able to do legs or anything. I could just go for a walk in the beginning. Other restrictions: alcohol, no alcohol for 6 weeks also. So this is what you should expect. Sutures should be taken after 10 to 14 days after the surgery. So probably in your first doctor appointment, they're going to take the sutures out. Like mine didn't hurt at all. Like it was easy process. And after this, you are able to take a shower. So this is good. And then after you take the sutures, maybe 2 weeks after, you're able to go to swimming pool. But if you like saunas, like me, then only about 4 more weeks after that point. Yeah, and then basically after that is purely physical therapy and having the first appointment. So that's all for this video. I'll continue the series talking a bit more about what you can expect in detail in the next days. So this video was just to let you know about what to expect up to the point that you leave the hospital. So soon I'll be posting a video talking about what you can expect for the first week, and later how the recovery process is happening. So that's all. Thank you very much.